guys, welcome to my channel. Today's video is going to be the difference between home health nursing and hospital nursing. Today I'm coming to you with a very short video from this very exclusive location, my kitchen. So today's video was a requested video. A lot of you wrote to me and wanted to know what the difference between home health nursing and hospital nursing is. As a lot of you already know, before I became a hospital nurse or RN, I was a home health nurse, an LPN for a long time. So majority of what I did as an LPN was home health nursing. I've never worked in a nursing home or any other facilities like that. Home health nursing was what I did. From my experience, a home health nurse is a nurse that travels to the patient's home to provide nursing care. So you can be there for anywhere from an hour all the way up to, I think, 12 hours to provide nursing care. So I've done shift nursing as a home health nurse, which is anything over 2 hours, and I've also done visits, which can be anything from 1 to 2 hours. Sometimes it can be a little longer, but usually visit nursing is anywhere from 1 hour to 2 hours. So you go to the patient's home, you provide your nursing care, and then you have to document your interventions and vital signs and then turn it into the agency, because usually home health nurses work through agencies. But the difference with hospital nursing is you get hired by the hospital, or maybe you came in through an agency. You go in, you clock in, you have a few amount of patients, anywhere from 1 to 5 patients assigned to you depending on what department. So if it's something like critical care or ICU, you typically might have only 1 patient. But if you're in med-surg, you might have 4 to 5 patients, sometimes even 6 patients, I've heard. You go in, you clock in, you do your hours, and then you go home. In the hospital, it's a teamwork kind of environment. You have your charge nurse, you have other nurses on the team, you have your doctor, you have caseworkers, you have your PCAs to help you out, you have your unit clerk, you have caseworkers and social workers and different specialty doctors, and then you have your managers, and you have a whole bunch of people that you're working with at the same time. Versus home health, where when you go, it's just you. It's still considered a teamwork environment, but you're there by yourself. And usually those patients are more stable, so it's okay to be there by yourself. But if you do need help, you can call the family, call the doctor, or call the case manager with any concern you may have. But the hospital, you have everybody right there. You can just pick up the phone and either call the doctor or go to the nurse's station, or talk to another nurse, or talk to the charge nurse. Those to me are the primary difference between home health nursing and hospital nursing. With hospital nursing, I feel like you have a lot more resources at your disposal because everybody is either a phone call away or just a few steps away. With home health nursing, you're on your own, but keep in mind that those patients are usually stable patients. Your job as a hospital nurse is to help the patients get better and go home. Your job as a home health nurse is to help the patient stay better and stay home. Another difference between home health nursing and hospital nursing that is kind of a pros and cons kind of situation depending on how you look at it is the travel time. So if you work 12 hours a day as a home health nurse only doing visits, that means you have to drive to 12 patients' homes, but you have some downtime in the middle. You can stop at the grocery store depending on what your schedule is with your patient. It's very flexible, but you have to drive to 12 patients home versus the hospital, where if you're doing 12 hours, you drive directly to the hospital, you park your car, go in, clock in, do your 12 hours, bam, 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 and you go home. Some people like that. On the other hand, some people don't like the responsibility of having more than 1 patient at once. So they choose home health nursing, where they're working with only 1 patient at a time, versus hospital nursing. Some nurses like the hustle and bustle of it all. It makes the time go fast, and they get to learn a lot within 1 shift. So they choose hospital nursing, where they have 5 different patients who most likely have 5 different disease processes, so they're learning as they go. In my opinion, there's no good nursing versus bad nursing or a preferable way to be a nurse. It just all depends on what you like to do and where you feel comfortable. The goal is to choose something that you're going to thrive and help patients out and not hurt somebody. If you feel like you're going to be too nervous and too scared to work at a hospital, then do home health nursing, because you only have that 1 patient at a time. But if you feel like you like the excitement, you like the hustle and bustle, you like to learn at a fast pace, then hospital nursing is for you. At the end of the day, it's all teamwork, because when the patients leave the hospital, they go home, everybody work together to be on the same page. The ultimate goal is to keep the patient safe and alive. That's our job as nurses, regardless of where you work. Those are the few only things I can remember between a hospital nurse and a home health nurse. I may be forgetting some stuff, but if I remember, I'll put it down in the description down below. I hope you guys enjoyed this video. Sorry it was a short video. I just wanted to come on here and clarify what I think the difference is between home health nursing and hospital nursing. Don't forget to hit the subscribe button. Give this video a big thumbs up. It really helps my channel and it helps motivate me to keep making videos like this for you guys. So thank you guys so much for watching, and I'll see you guys in my next one.